like to welcome everybody to our program today, COVID vaccinations with Sridevi Mohan, Stacy Lamp, and Mike Flint. The program will be recorded, so you can always catch it at our YouTube channel, Triads of Dane County. Mike, why don't I go ahead and turn it over to you, let you get started.
Good morning, everybody. Thank you for being on the call. And we've had a lot of fun putting this presentation together, working with Stacy Lamp is our pharmacist at our long-term care pharmacy at Guardian Pharmacy in Milwaukee. Stacy and I have been working a lot on the whole COVID situation, acquiring vaccines and giving vaccines to our clients and our long-term care facilities all around the state. We've been working with Sridevi Mohan, who's an epidemiologist with Madison and Dane County, and we've had a lot of fun putting this presentation together because we started doing that a couple of weeks ago, knowing full well that on a daily basis the information is changing. So we've probably changed this presentation numerous times to keep up with a lot of the changing information. In fact, I would say just this morning, we received new information on the longevity of the storage of some of the vaccine things and the availability of vaccines and stuff. So it's a moving thing, but we've been very happy to be part of it. I am the president of Guardian Pharmacy, which some of you may recognize the names of Prescriptions Plus Pharmacy in Milwaukee and Malat's Pharmacy in Madison and Menominee Falls. We partnered with Guardian Pharmacy about 2.5 to 3 years ago. And so we're under one name, Guardian Pharmacy, and we serve long-term care facilities all around the state, nursing homes, assisted living facilities, group homes, a lot of different agencies that we work with as well. So thank you for taking the time to be on the call with us. We're looking forward to giving you some information. I'm hopeful that'll be very useful for you. We look forward to any questions that you might have and things like that. So with that, Stacy's in control of the slides, so I will let her kind of work that. This is what we hope to cover today is the COVID-19, the vaccine distribution. That has been quite the exercise of when we're going to get stuff, how things are going to come in, who's going to bring them, when they're going to bring them, how we find out that information. We'll talk a little bit more about that. As I mentioned to you before, a lot of the information that we have and how we work and who we can vaccinate are people in the long-term care world versus retail. And this is really important because particularly in the long-term care world, that has been the group that we initially, or the government wanted to focus on, people over 65. And so we've been focused on making sure that these people get vaccinated. And there's a federal program in place for that. And then there's things more on the local level. And we'll talk about that. Sri's going to talk about the different types of vaccines that are out there. I'm sure you have a lot of questions about those. So looking forward to that discussion. Not only the ones that are on the market right now, the Pfizer and the Moderna, but Johnson & Johnson is coming. And there's one or two out there, a Novavax that we can get some information on as well. The COVID variants, Sri's going to talk about that. We've been hearing about mutations of the virus and what does that mean? Are the vaccines going to be able to help with that? So we'll talk about that. The vaccine safety monitoring, I know there's questions. People want to know how safe it is. What's an RNA generator and what does that do? And so we'll talk about that. And then we'll wrap up with, I think, some continual guidance on how we need to behave, whether we have the vaccine or not. There are things we still need to do. We need to continue to do so we can get a handle on this and keep everyone safe until we can get the whole vaccine piece done around the whole country. And we are a ways away from that. And people need to understand that we don't want to change our behavior just because we're vaccinated. So those are our topics for today. So I'll turn this over to Stacy, talk about kind of narrowing in on what's happening in Wisconsin.
Thank you, Mike. So in Wisconsin, vaccination is an all hands on deck approach. We all have our parts to play in order to make sure our population is getting covered with the COVID-19 vaccine. So this involves activating qualified vaccine providers across sectors to provide many avenues for Wisconsin residents to access vaccine. The vaccine distribution needs to be swift, safe, and efficient while ensuring equitable access. Equitable access is definitely a topic we could spend a lot of time on. And it's a topic that the state of Wisconsin is very focused on in making sure that there is equitable access to the vaccine for everyone across the state. So the Wisconsin Department of Health Services, otherwise known as DHS, has said that they are aware that there's systemic barriers and social factors that including access to quality healthcare, housing, transportation, and job opportunities, which is often referred to as systemic racism. But this has exacerbated the disparate impacts of the COVID-19 experienced by Black, Brown, Indigenous, and other communities of color in Wisconsin, including disparities in vaccine rates. Through targeted distribution and strategic outreach with community stakeholders, Wisconsin is making deliberate choices to reduce barriers to access the COVID-19 vaccine and provide much needed relief to communities that have withstood the worst of this pandemic. Demographic information such as sex, race, and ethnicity are not necessarily required to be reported in the Wisconsin Immunization Registry, otherwise known as the WIR, which means that it is more difficult to determine where the most help is needed across the state. Any data that is submitted in the WIR provides insight into the vaccine program and helps inform decisions to ensure vaccine distribution is fair and equitable. So every time that we administer a vaccine in the state of Wisconsin, we are required to input this information into the WIR. The more information that we can input, the better off we all are in knowing where these holes kind of are in the programs across the state. Vaccine eligibility is implemented in phases as a state. The phases do overlap, and this is to optimize access and continuous uptake of vaccine. So COVID-19 vaccine distribution. Currently, there are weekly allocations of vaccines to each state in the country from the federal government. In the past 2 weeks, Wisconsin has been getting about 70,000 vaccines allocated each week. This is likely to increase to about 100,000 in the next couple of weeks, but this is always just a prediction. Until the vaccine actually arrives into the state of Wisconsin, we never actually know exactly how much that we're actually going to receive. So as Mike said earlier, there are 2 vaccines that are currently on the market and being distributed across the country. The Moderna vaccine is delivered directly to the vaccinating entity. The Pfizer vaccine, which I'm sure you might have heard from the news or other public outlets, that it is the ultra cold frozen vaccine. This vaccine is actually sent to 8 hubs around the state and then is broken down into smaller amounts and redistributed to local entities that can use the vaccine. This does create some problems with the Pfizer vaccine in that in this ultra cold storage, it does have a longer shelf life, but as soon as it is unfrozen, shall we say, and redistributed, it has a ticking time clock on it of 120 hours before it is no longer any good. So that sometimes can impair how well we can use that vaccine within the week. If that 120 hours and 5 hours of it is taken up in transport before it gets to the end entity to use, we are already kind of behind the game in being able to use that vaccine. And I can tell you from personal experience at our pharmacy that we have been receiving Pfizer vaccine this whole time. And every week it is different as to when it gets delivered to us. Sometimes it comes Monday morning, sometimes it comes Tuesday afternoon. I'm supposed to be receiving vaccine today and I have no idea when it's coming. It could come this morning, it could come this afternoon. I don't know until I receive it what the expiration date is on that vaccine, because I do not have any information ahead of time as to when it was broken down into those smaller pieces. So
if I might add to that, if I can add to that, one of the challenges is us just trying to plan these vaccine clinics for our long-term care residents. And so we have to have a lot of people, in a queue basically that says, we can't really, we can say this will be the date, but we really don't know. And then there's just a lot of activity in a couple days on everybody's end, on people in the long-term care facility. They got to mobilize people. They got to, get people ready to go. We're going to do this tomorrow or the next day. And so it's just the challenge of it. And most recently, the challenge got even bigger with the storms down south and in Texas. They've negatively impacted the ability to transport Moderna vaccine. The Pfizer still seems to be coming along, but the Moderna vaccine seems to be held up. Not sure where the transportation issue is, but a lot of this scenario, we're a prisoner to just the logistics. And it's real. It's a major problem.
Stacy, did you say 120 hours?
Yes. So once the vaccine leaves the hub, it has an expiration date of 120 hours, which is roughly about 5 days. But that time clock starts from the minute it is broken down into smaller amounts.
Right. Okay. Thank you.
You're welcome. So along with these weekly allocations of vaccines also comes ancillary kits that have the vaccinating supplies that we need to administer the vaccine. So in these kits comes the diluents that we need to use for Pfizer. Pfizer does have to be diluted before it can be administered. Moderna does not. Moderna comes ready to use. Diluents, we get syringes to do the dilution process. We get syringes for administration. We receive alcohol wipes, face masks, and face shields. What's not provided that we have to provide on our own is gloves, Band-Aids, sharps containers. Those are probably the biggest items that we have to make sure we always have in-house, so that when the vaccine shows up, we are ready to go. The ancillary kits for the Pfizer get delivered with the vaccine when the courier brings that to the entity. When it's the Moderna vaccine, the ancillary kit is shipped directly from the manufacturer. I wanted to talk a little bit about the phase groups for vaccinations. These are the groups that are currently eligible for vaccination in the state of Wisconsin, as well as what we can kind of expect coming up here in the next week or so. Currently, right now, we are in what they're calling phase 1A, and this is covering direct care healthcare personnel, long-term care facility residents and staff, police, fire, and correctional staff, and persons age 65 and older. So this is why we have become sort of a player in this game, if you want to say, is because this phase really encompasses everyone that we service in our long-term care pharmacies. So long-term care, healthcare personnel, persons over age 65, that is everybody that we service through our pharmacy. Coming up in phase 1B, which is tentatively scheduled to start March 1st. And as of yesterday, we were still talking that it's going to be March 1st. But until that date comes and the state says, yes, this phase is open, we won't know for sure. Phase 1B will prioritize educators and childcare workers ahead of the other persons eligible in this phase. And I believe as of last night, the state had come out and said that they are going to be partitioning off some of the vaccine coming in from the middle of March, and putting it aside directly for the local health departments to use for the school districts and child care centers in their county. So that will be nice that there will be set aside vaccine for that sector of the population, as a lot of the educators and child care workers have been, involved in groups of people this whole time in this pandemic. I personally, my husband's a teacher. He works in the school system. So, and they've been in school this whole time since the fall. So they've just been, taking precautions and changing standards and how they do things. But having a vaccine would make tremendous difference to them in that environment. So I'm excited for that to kind of start going here. Other eligible groups in phase 1A is individuals enrolled in Medicaid long-term care programs. And then they're saying some public-facing essential workers, like food supply, public transit, utility and communications infrastructure, and 911 operators. And will also include non-frontline healthcare personnel and congregate living facility staff and residents. So we're really going to be moving forward, and I think this is a great step, and I hope that we will be able to open this up March 1st and keep moving through the vaccine. A lot of us, and of course, on the amount of vaccine coming into the state and how well we are utilizing it and how quickly we are utilizing the vaccine.
I'm curious as to when are they going to give the people that have high risk to the getting COVID. I mean, the high risk
I know.
people. When is
Right.
that coming on?
You're talking about people that are high risk based on their like medical history, not
Right,
on
like
their work environment.
immunosuppressed, right. I'm immunosuppressed and I'd like to know when I'm gonna get it.
And I do not have an answer for that.
Why isn't that a big deal?
I don't know. I don't disagree. I honestly would have thought that that would be a consideration in these phases, but that's the recommendations have come out from the CDC, and this is what the state has adopted. This is all the information that I have to go on right now.
Can somebody ask about that?
Oh, we have. Believe me, we have. And I think it's one of the things that is challenging through this whole thing, like I had mentioned before, is that we are in a spot in our world of very little control over anything. We have a systematic way we can order, and that changes every week. And then when we talk about these groups, these are being fed down to us by the CDC. I've been on numbers of calls on the federal, state, and local level asking that same exact question. And I think what the challenge is it's about the availability of the vaccine, period. And
Why aren't they in one of the early phases? That's what I want to know.
And that's a good question for the CDC. My belief is I don't think they're able to quantify that group of people and how they can get vaccinated. So someone, for example, and I know plenty of people who are immunocompromised, they don't fit into these categories. One of the challenges is, well, how do you get them vaccinated? I'll give you a good example. Is I know people who are immunocompromised, they've reached out to their physicians at UW in Madison and other clinics, and UW, the other clinics, they don't even have vaccine. They don't even have vaccines. So they're not even in the distribution network at this point. So I think right now, to answer your question, it's a logistics problem. It's just a logistics problem. We could say, yes, you're in the group, but how are they going to get vaccine to that particular area, whether it's clinics, whether it's pharmacies? And I just don't think they are able to identify that group, since it's across the whole board, right? You can be immunocompromised at the age of 6. You can be immunocompromised at the age of 60, and then everything in between. And so trying to identify this group, I don't think they're able to. Now, again, we're not a decision making in that piece, but we know how difficult it's been to identify groups who are eligible to receive the vaccine. So I'm with you, because I have plenty of personal experience with people that I know that are wondering when can I be vaccinated. So it is frustrating. I do think.
I mean, why can't they look at that group?
That's a great question.
Like, because the CDC comes with those guidance, and then initially, because some of the trials that had like for these vaccine development, not a lot included some of immunocompromised, and then some included immunocompromised individuals. So I think then only when they develop like more data that the vaccine is more supportive, like, right, in certain populations, and then they can come up with more confidence in saying that it would help in certain populations. And I think now the CDC did say that some of the vaccines can be given for like pregnant women and immunocompromised folks. So they would be looking into it. And then when CDC gives the guidance, the State Disaster Medical Advisory Committee is the committee that makes those decisions based on certain criteria of who gets that on that list. But it is probably in conversation, but we're on the local level, we don't have a say in any of this. It's like it comes down from the CDC to the state, and then the state decides based on the advisory committee's guidance who would be on those priority lists.
Thank you. I'm going to move on to talking about the vaccinators of these eligible groups. So currently vaccinating 1A eligible groups is the health systems, so hospitals and clinics and some pharmacies. We have the Federal Pharmacy Partnership Program, which encompasses Walgreens and CVS and some of the long-term care pharmacies that are working to receive vaccine from the federal government directly and vaccinate those in skilled nursing facilities and assisted living. And then we also have the local and tribal health departments that are working with the unaffiliated healthcare personnel. Coming up for the next group of eligible patients, starting possibly March 1st, we said, those that would be doing the vaccinations would become a larger group, hopefully, to reach more people. So we have the local and tribal health departments, we have pharmacy partners, we have hospitals and clinics, we have employers, home health agencies, we have state and federal assistance, so community-based vaccination clinics and mobile vaccination teams. And the local and tribal health departments are coordinating efforts in their local jurisdictions, which is what I kind of touched on in the previous slide with focusing on the education and childcare sector here in March. So this is a summary of the COVID-19 vaccine dashboard from the DHS website. This is updated every Tuesday at 2 p.m. It's available to the public online. And this is the most recent update yesterday. As of after 2 p.m., I put it onto this slide. So this, let me go through and kind of explain what this is showing us. So on the left-hand side, the allocated number of vaccines, so that 1.62 million, this is the total number of all COVID-19 vaccine doses that are made available to Wisconsin by the federal government, including those doses that are allocated to the long-term care partnership program, which is the subset of the total allocation. This number also includes the first and second dose allocations. And the doses that are allocated to Wisconsin are based on the Wisconsin's population size compared to that of other states, regardless of the state's vaccination phase that they are in. So below that allocated number of 1.6 million, you see the pharmacy partnership program, and that's the breakdown of how many vaccines have been allocated to skilled nursing facilities and assisted living facilities. Then moving along to the right, we see the ordered section. So this is roughly about 1.2 million vaccines. This provides the total number of COVID-19 vaccine doses that have been ordered for vaccine providers in Wisconsin from the federal government's allocation for the state. This is the number of vaccines that pharmacies, healthcare systems, clinics have been ordering or placing requests for to the state of Wisconsin out of that total allocation. In transit, the 208,000 doses. So this shows us the number of COVID-19 vaccine doses that the providers in Wisconsin ordered in the previous week. And these doses have been shipped by the federal government and are in transit to local or to vaccine locations throughout Wisconsin. The doses will arrive at these vaccine locations throughout the week for providers to administer. And the administered doses, this is the total amount of doses that have been administered to people in the state of Wisconsin. So at this moment, we are over 1.2 million doses of vaccine given, which is a really good number, but we just have to keep going. It's just not good enough yet. Nothing will be good enough until we are done. So this is the total, includes Wisconsin residents and non-residents who have received the COVID-19 vaccine in the state. The line below does show us the change in vaccines administered by the day. And you can kind of see that as the week goes on, that number does get bigger because the amount of vaccine that's moving, it takes a couple of days to get moving through the state. And then by Wednesday, Thursday, Friday, Saturday, we're giving huge amounts of vaccine because we finally have vaccine at the entity that can vaccinate. This is the breakdown of the Wisconsin states here. So on the left, this is showing us the percentage of Wisconsin residents who have received at least one dose of vaccine. So right now we are at about 14%. And you can see below the breakdown in age, sex, and race, and ethnicity as well. And then on the right, we can see here the percentage of Wisconsin residents who have completed the full vaccine series. For Pfizer and Moderna vaccine, both of them require a 2-dose series in order to be completely vaccinated. So we have 6.3% of our eligible population that is fully vaccinated. And by eligible population, we are referring to those that are 16 of age and older, because that is what the Moderna vaccine is authorized for. The Pfizer vaccine is for 18 and older. So those 16 and under are in that little gray area to the right of the half circle, and that's what's showing of the total population in the state of Wisconsin. Not just the populations that are eligible for vaccine in this current phase, not just the healthcare workers and the long-term care residents. This is for the total Wisconsin population. Okay, so this is going to be kind of my talk on the COVID-19 long-term care process. So this is going to be kind of start to finish on what it kind of takes to receive vaccine in the pharmacy and what it takes for us to administer and give the vaccine. So I wanted to start out by just briefly talking about the federal long-term care partnership program. So this involves the federal government and the CDC. They contracted with Walgreens and CVS pharmacies across the country to vaccinate residents and staff in long-term care facilities. The allocation of this vaccine in Wisconsin has been largely the Moderna brand, this consistent across the board. And this has been easy for them due to its storing capabilities of refrigerated state versus the ultra cold, and its administering capabilities without having to be diluted prior to use. So I'm going to pass it back to Mike for just a few minutes to have him give a more global take on Guardian Pharmacy, as we have pharmacies across the country, and how it differs from state to state.
You know, one of the things we've learned, and I think a lot of people ask a lot of questions, is like, well, how come this is taking so long and things? And Stacy and I were talking about this earlier this morning, is that we kind of felt in the beginning, the state of Wisconsin seemed to be kind of slogging along with trying to get the logistics right. But then I think they seem to catch up, and I think now we're way ahead of the game. We have Guardian pharmacies in Indiana who haven't even been approved as vaccinators yet. Haven't been able to receive vaccines to be able to distribute to people. We've heard like West Virginia, where all the long-term care clients have been vaccinated first and second round. So there's a huge disparity between the states as far as the availability to get vaccines, and the boots on the ground is being able to give vaccines. Some people, are utilizing, the Army and the reserves and things like this to be able to do this, and some people are not. So it's every state is. I've even heard the conversation about bidding for vaccines and things like this. So there's a little bit of a, hate to say it, in this world of competition to get supplies and things like that. So it's very inconsistent. We feel really good about what's going on in the state of Wisconsin. We feel really good about it. Sure, we wish we could get more vaccine, but I think the logistics have been thought out well. And there's just a process that Stacy had talked to about how we have to go through. One of the things that I want to mention is the tremendous amount of record keeping through this process. Sri mentioned that a little bit, is the CDC and the whole world is trying to take this scenario we're in and doing the best we can to gather information so that we can best address this current situation as well as the next one that might occur. Logistics like hooking up the federal databases to the state databases, that's huge. You'd think that would have been done beforehand, but it wasn't. So this has kind of been a wake-up call for the infrastructure of our healthcare system to be better. And one of the challenges of us is we have to provide this documentation. It's so quickly within a 24-hour period of time that it sometimes maybe gets in the way of actually the vaccination process itself, because this isn't just a pharmacist giving somebody a vaccination. It all has to be recorded, it has to be documented. So it's real challenging, and it's totally inconsistent around the country. But as far as in the state of Wisconsin, I think it's pretty darn good, and hopefully it'll stay that way. And yep, everybody has to be patient as we work through this process. And once the Johnson & Johnson gets approved, we might be in that scenario where we have a whole ton of vaccine, and then things can get rolling. So be happy. I think that we're in the state of Wisconsin. I think they're doing a good job.
Thank you, Mike. So I'm going to start out with talking about the ordering process. So to order the COVID-19 vaccine in the state of Wisconsin, we as our pharmacy had to go through a very lengthy application process with the state in order to become authorized as a vaccinating entity. This process took us about 3 months before we were approved, and it also involved us having to do some specialized training for team members that would be involved with the vaccine, including pharmacists, billing employees, and inventory persons. So we now receive a survey weekly from the state of Wisconsin in which we indicate how many vaccines we would like to order for the following week. Those vaccines need to be used up within that next week for the current eligible vaccinating populations. We need to anticipate how much vaccine we need for any long-term care facility clinics that we tentatively have set up. And we also do not have a choice in which vaccine is allocated to us, either get Pfizer or Moderna. Typically, it seems that once you start receiving one kind of vaccine, that's what you will continue to receive. That has been our experience. We received Pfizer the first week, and we have received Pfizer ever since. So we do receive notice a few days ahead of time if we are allocated vaccine for the next week and how many doses that will be. We are never guaranteed to receive the full amount of doses that we requested. So that's why Mike made the point earlier that any clinics or vaccination appointments that we set up are always tentative until the vaccine is in hand. So this is also when we are told when to expect the vaccine to be delivered. And that can be anywhere from Monday, Tuesday, Wednesday, typically. This notice would come in on Friday, and then we would receive the vaccine the following week. This is a very short period of time to organize ourselves for the next week. We always kind of have to be on the ball and keep things moving. Everything is tentative until we receive vaccine in our hands. We do schedule clinics for our long-term care facilities ahead of time in order to know how much vaccine they might need, but we always confirm with that facility just a day or two ahead of time once we receive the vaccine at the pharmacy. We have also been trying to accommodate vaccinating persons age 65 that can get to our pharmacy. So these appointments are scheduled from a standby list. Persons are usually only given a day or two notice of an appointment once we know that we may have some extra doses available. We really do our best not to waste any of this vaccine. It's a very precious commodity that we want to be able to get into the right hands in the community, or the right arms, I should say. We have been receiving mostly Pfizer in our pharmacy, which means it does need to be diluted before administration. The diluent and the syringes needed for the process are included in the ancillary kit, as I said before. Pfizer is a 2-dose series, and it does have a dose of 0.3 mLs of the vaccine each time. And the Moderna, also a 2-dose series, has a dose of 0.5 mLs of the vaccine each time. So the vaccine can be tricky. Pfizer is shipped to the hubs around the state in specialized shipping containers to maintain this ultra cold temperature. The hub keeps the vaccine at this temperature in ultra cold freezers, and then the Pfizer vaccine is split into smaller amounts, and a courier service distributes the vaccine to other clinics, health departments, or pharmacies for administration. Once the vaccine is redistributed from the hub, the receiving entity has that 120 hours, or roughly 5 days, to use the vaccine before it expires. The package that we receive will actually give an exact date and time of when the vaccine expires. So we never have to guess. It is written on there for us. The vaccine can be stored then at normal refrigeration for those 120 hours that we have it. Daily inventory for the vaccine is recorded in the Wisconsin Immunization Registry, or the WIR. The Moderna vaccine has an easier storage requirement in that it can be frozen or refrigerated at normal temperatures for each of those environments. This does make it more appealing to pharmacies that have kind of storage issues. I thought that was going to be an issue for us, but honestly, we've been receiving the Pfizer vaccine and we've just learned now this is what we have to do with it, and just becomes part of our process. So tracking second doses for both of these vaccines is necessary for the Pfizer and the Moderna. The second doses of each vaccine are shipped to this vaccinating entity automatically when they are due. So I don't have to keep track of when my second doses are needed for the Pfizer vaccine that I gave 3 weeks ago. I am given a heads up that the doses are coming next week and they are to be used as second doses for those persons. The due date is kept track of by the state and the CDC. I personally keep track of this information myself as well in the pharmacy on an Excel spreadsheet. It does help me make sure that I am receiving the right amount of doses and that the right persons will be vaccinated in the appropriate week for their second dose. Once we know the second doses are on their way, we work to schedule the appropriate long-term care facility clinics and retail appointments all over again. So we repeat the same process we did for the first doses that we do for the second. Once the vaccine is administered, our billing team must enter those vaccinations into the WIR system within 24 hours. And they will also enter the patients into our pharmacy system and bill for the appropriate administration fee. So it is important to note that the COVID-19 vaccine is free for everyone. There is no cost, but the vaccinating entity is allowed to submit an administration fee for reimbursement for our services in time. So that's all I have on the vaccine process, and I will turn it over to Sri to talk about the types of vaccine.
Hey, thanks, Stacy. So I'm just going to talk about the types of vaccine that is out there, and then a few that might be following suit. So the Moderna and Pfizer, as Stacy mentioned, are the ones that's out there that they have been approved, like the emergency use authorization has been granted, and that's the one that is out there for folks to receive right now. And then they both are, the type of vaccine is mRNA, that's the messenger RNA kind of vaccine. And then the Johnson & Johnson is an adeno-vector, a virus vector, and the AstraZeneca is also similar to the Johnson & Johnson. The Johnson & Johnson is a single dose vaccine, whereas the rest are all like 2 doses with like maybe 28 to 21 days apart. And then the AstraZeneca is kind of like maybe at least 30 days apart. And then the Johnson & Johnson, they have submitted for the emergency use authorization to the FDA. So we're probably expecting an approval by March 1st. So if that happens, then there would be like more vaccine supply in the supply chain that would add on to like the Moderna and Pfizer that is already out there. And the AstraZeneca and the Novavax, they are all in their phase 3 last phases of the trial. So probably like after that is completed and they gather a good amount of data, then they would also follow suit and go for an emergency use authorization. So when you look at the effectiveness of these vaccines, most of them have a good, like they are effective in preventing symptomatic spread of COVID-19. And then the Johnson & Johnson, although it is a little on the lower end, is still pretty, it would help in preventing moderate to severe COVID-19 as well. So there are 2 links in the bottom of the slide. Like if you click on that, you can understand a little more about the emergency use authorization program process, and also what happens from clinical research to the EUA process. So there's a lot of question because the vaccines have been made like really in a swift manner, whereas in other previous times it would have taken a longer time for the vaccine to be going into like the phased trials and then come for the approval process. But this one, because it's quicker, there's a lot of questions on people's mind. But if you look into that process, there's no steps have been skipped in these processes. So, and that would give you kind of like an idea about like how these vaccines came, like, you know, from the clinical process to where it is right now. You can see that a little clearly. Next slide, please.
Sri, may I ask you a question? Do you know if there's any recent information on, you know, how long these vaccines are going to produce the antibodies we want them to do? Is this going to be an annual event or 6-month event? Is there any latest information on that?
So, Mike, the like for now, the conservative thinking is 90 days, right? But then there is data to support that they might be going longer than that, but there is not like conclusive evidence saying that, and we might need like booster doses at some point in time, or this could become like an annual routine shot, like a flu shot. But there is not enough conclusive evidence right now to point us in that one direction. For now, their conservative approach is because they want to make sure, like, and as they are gathering this data from, as more people get vaccinated, we're all contributing to this data as well, right? So then you would be able to kind of like see for how long this immunity lasts. So there are a lot of questions about this mRNA vaccine. So what mRNA vaccines are, you know, they contain like genetic material, that is the mRNA, messenger RNA, that teaches our cells to kind of like produce the spike protein. The spike protein is the protein that is found on the surface of the coronavirus. And that's what it uses to like inject itself into our cells. And then this mRNA teaches our body to produce that spike protein. And once the spike protein is displayed from like on our cells, then the antibodies are produced. And then once you're infected, then with the coronavirus, when you're exposed to coronavirus, then the antibodies are there and that triggers your immune response. And then you would be able to like, you know, fight it off. So, and then there's a link to the YouTube video that shows how the mRNA vaccine works. Next slide, please. And so some facts about the mRNA vaccines is these vaccine, like once the genetic material kind of like triggers that, like gives that information, it is destroyed by the cells and then the copies of the spike protein are made and it's then not needed, so it gets destroyed. And they don't affect our DNA or they don't enter our cell nucleus, because that's a common question that comes on people's mind, like, oh, is it entering or is it modifying our DNA? What would happen? But that's not the case with these vaccines. And the mRNA vaccines are faster to produce than older technologies. And this is although it's a new technique, these have been studied for a very long time in like around the world and in the US. They have been studying this type of vaccine for Zika virus, for flu, and other like cytomegalovirus as well. So it's nothing, it's the vaccine right now is new because you had to produce that in a short amount of time, and the mRNA vaccines allowed that to happen, but it's nothing, it's not new to the scientific world. It's been there like studied for a very long time. Next slide, please. And the other ones like the adenovirus vector, right? Like the Johnson & Johnson vaccine, and then the, what is the other one? The AstraZeneca vaccine, they both are the viral vector vaccines. So what happens with a viral vector is that they use like a modified version of a different virus, that is the adenovirus, which causes common cold. And then they use that virus, they inject that virus with like, they mix up like the genetic material from the COVID virus is inserted into this viral vector. And that's the one that is in our vaccine. So then what happens is that will enter our cell and then causes our cell's machinery to produce like a harmless piece of that same spike protein. So an immune response then will be triggered inside our bodies, and then then this kind of like produces like antibodies to protect us from the disease. Next slide, please. And the facts about viral vector vaccines are, again, they cannot cause infection with COVID-19 or the virus that used as the vaccine vector. And also they do not affect or interact with our DNA in any way. Next slide, please. And the last one is like the protein subunit vaccine, the Novavax, which is kind of still in development, is this protein subunit vaccine. So in this vaccine, rather than injecting like the whole pathogen to trigger an immune response, parts of the protein, right? Like the subunit vaccines, they contain like purified pieces of the harmless proteins, and which is really carefully selected to stimulate some immune response. So that is that's the one that is present in the vaccine. And then that triggers an immune response. But because it is very precise in invoking a response, this might have like a weaker immune response within our body. It's precise, but then the immune response is a little weaker. So what they do is to boost the response, they add the adjuvant to kind of like stimulate our immune system. So this Novavax uses this method to kind of like produce their vaccine. But then because these fragments are not like capable of causing any disease, these are considered like very safe. And this has also been kind of like done for like other like diseases as well. Like protein subunit vaccine has been there for a long time as well. Next slide, please. So some of the common side effects from the vaccines that is out there right now are fever, chills, body aches, soreness at the injection site. And it is normal to have these. So, right, like when you have these reactions, it's not that you're getting COVID or anything, but it's a sign that your body is kind of like building protection and you're getting to the virus. And most side effects should kind of like go away in a few days. And then the likelihood of a severe side effect is like really, really low. It's about 0.5%. Next slide, please. So there is a lot of talk about the COVID variants, right? Like there's many cropping up all over the world, and there is like lots of concerns regarding this. But this is very common, like in the virus world, right? Like they are constantly changing through mutations, and then new variants keep coming for any kind of disease, not just for COVID, like for any diseases. Like they would change over time, and then some variants they emerge and they will like go away, and then sometimes then the other variants may just emerge and then they live for a while. So the three types of variants that has been reported here are the B1.1.7, that's the UK variant, and then there are 44 states reporting that variant like in the US. And the next one, B.1.351, is like this is the South African variant. There are 10 states reporting those cases, and then the P1 is the variant that was found in Brazil. So, and then there are about like 4 states reporting that variant in the US. And then in Wisconsin, we've identified 6 cases of the UK variant so far. But you should also keep in mind that not all of the positive tests are being like sequenced for this, like to find what kind of variants they are. It's a sample of the tests that are kind of like, which would be then sent for further analysis. Or like when you're just testing, that would not kind of determine which variant you have. But when it is sent for this whole genome sequencing, that's when you would be able to identify. And Wisconsin State Lab of Hygiene is one of the lab in the US that is capable of doing these whole genome sequencing. Next slide, please. So what we don't know about vaccines and the variants are, with the vaccines. So we know that it prevents you from getting COVID, we do not know yet, like if that vaccination would spread, like, prevent the spread from from you, like a vaccinated person, to another individual. So the transmission dynamics is still under study. That doesn't mean that it's not going to prevent that, but that still data, they need a lot more data to like have that conclusive evidence. And then like Mike asked about like how long would this vaccine be effective, right? So again, the conservative thinking is 90 days, but that would be subject to change as we can gather more information. And then also like, will additional boosters be required? We don't know that yet. Maybe we would require at some point in time. And with the variants, what we don't know about the variants are how widely these have spread. Because again, as I said, we're only testing a few of these tests, right? Not everybody who has a positive test, that all of those samples are not being sent for testing. And then we don't know how the disease caused by this variant or these variants differ from the other variants that's already circulating. And then we don't know how these variants may affect like existing therapies, like the monoclonal antibody therapy and other therapies, the vaccines and the tests. So we don't know about that. Next slide, please. So what we do know about the existing vaccines are they are safe and effective. They will not give you COVID. So many folks are like thinking, oh, what if I get the vaccine, then I might get COVID. No, they cannot, because they are not live or the attenuated vaccine that could give you COVID-19. And this will also not make you have a positive test after you have the vaccine. And most of like all of the current COVID vaccines, which is there in the US, is like highly effective at preventing the disease. And then they are like when they are the ones that are in development are being carefully evaluated in clinical trials. And they will only be authorized if there is substantial evidence to show that this minimizes or their risk of getting COVID. It's not, they will not just because a vaccine is out there without like proper or like good clinical evidence, they are not going to approve that. And then based on what we know about the vaccines for other diseases, like it's very clear that this COVID vaccine may also help you from getting like seriously ill as well. Even if you get COVID, it might not, like you might not end up in hospitals, or like this would also definitely prevent like serious cases of COVID-19, which is very important for folks who are like on the higher risk category, right? Like that's what we've seen throughout this pandemic, that people who are at a higher risk, it often leads to hospitalization and death. So this one, at least from the data that is there, that it might prevent like severe COVID disease. So getting vaccinated yourself will, you protect yourself, and then you also protect the ones around you. Next slide, please. So there's a lot of question about like vaccine safety, right? Like, so people ask, how do we know these vaccines are safe? So the CDC and the FDA, they continuously track and monitor the safety of vaccines even after they get authorized, not just like, once they get authorized and people get shot in the arms, it's not like a said and done kind of like work. There is like continuous monitoring that goes on with some of these systems. There are like 4 systems which are there, which are in existence, that they have been there for a long time. And they monitor the vaccine safety. So the vaccine adverse event reporting system is like a federal system where there's any small like change after you receive a vaccine, that information gets loaded into this VAERS system. There's a vaccine safety data link, then the clinical immunization safety assessment, a couple of different systems are already in place. And then the CDC recently, they also added this vSafe, that's like a smartphone-based health checker. So once you get the vaccine, you could like download that app, and then you can report any health problems after you get the COVID vaccine. So that is also up and running right now. Next slide, please. So Wisconsin Vaccine Registry, so DHS, like as Mike said, there is like a lot of difference in how the states are distributing and registering. And the same way, even within the state, each county has a very different way of registering folks to get the vaccine. The health systems has its own registry system, and then the local public health would have, the pharmacies have their own system to get people registered. But at DHS, the Department of Health Services in Wisconsin, they are creating this vaccine registry that is like an overall registry that would help people to access available clinics within their area and then schedule an appointment online. There is also conversation about a phone line that would be added as well for people without access to internet and email. So this registry is, they are going to pilot test this on March 1st, and then it's up to with a few counties, and then it would be up to the counties to either sign on with that, or they can go with their own registration system. But this vaccine registry would have once as people become eligible for that the vaccine, then they can go onto the registry, and then it would help them identify who the vaccinators are within their locality, and then get an appointment. Next slide, please. I think now it's time to turn it over to Stacy. She will talk about quarantine after vaccination and what you can do to help you and your loved ones be safe. Thank you.
So this is fairly new guidance that has come out from the CDC and has been adopted by the state of Wisconsin as of February 16th. So we kind of had to think ahead now as to what happens after we're vaccinated. What do we need to do? Can we now stop wearing masks and everybody can get together again? The answer to that is no, we cannot. There are some certain guidelines, though, that have been put together to kind of help the quarantining process that has been happening during this COVID-19 pandemic. So the guideline does state that quarantine is not necessary if you're in the general public. You have to meet all of the following. You have completed the vaccine series. The exposure happened between 14 to 90 days after completing that vaccine series, and you have remained asymptomatic since the exposure. If you meet all of those requirements, quarantine is not necessary anymore for a close contact exposure. For healthcare personnel, you must meet all of the following. You must have completed the vaccine series. Exposure happens between 14 to 90 days after completing the vaccine series. If the exposure is more than 90 days after completing the vaccine series, they must participate in serial testing. If they do not participate in serial testing, they must quarantine. And they must remain asymptomatic since the exposure. So we do see that the guidelines do become a little bit more strict for healthcare personnel that are kind of in direct line with patients. So quarantine necessary if you meet any of the following. You have not completed the vaccine series. The exposure happened prior to 14 days after completing the vaccine series. It does take about 14 days for the body to realize that full vaccine and become protected from COVID. Exposure happened after 90 days after completing the vaccine series, and then you can see the exception for the healthcare personnel. You've been symptomatic since the exposure, or the patient's receiving care in an inpatient setting, or the patient is a long-term care resident. So this guidance is definitely subject to change as we learn more about the duration of the vaccine protection. And as a precautionary first step, I know Sri touched on this as well, that this 90-day limitation was chosen by the CDC/DHS. However, this does not necessarily indicate that the vaccine wanes after 90 days. It's just a very conservative number that we are working with at the moment.
To add on that is, in our world, we are delivery drivers who bring medications to the facilities. They're not entering the facilities. They drop the medications off by the door. We have a mechanism set up with the staff for them to get it. We do have a few people who do need to enter the facilities. And because of, we're trying to be as proactive as possible, these individuals, what Stacy referred to before as serial testing, get tested every week or every other week, depending on the rate of infection going on in each county. So it's very strict guidelines on our end as we enter buildings with the most vulnerable population. So we make sure that our pharmacists or our personnel who need to enter the building are tested on a regular basis so that we keep those patients safe. So that does not change for this moment. It just does not change. So, things stay the same, even though we've been vaccinated, to make sure we keep everybody safe.
All right, so just to wrap up our presentation, just some tools to keep you and your loved ones safe. So just because you have been vaccinated, that doesn't mean that we can just stop and go back to normal per se, whatever that means these days. So vaccines are just one of the tools that we have to fight the COVID pandemic. But we still need to keep up with the frequent hand washing. We still are going to have mask guidelines. Covering your coughs and sneezes, always important, but especially important in a pandemic. And maintaining that social distance of 6 feet as much as we can. All of these things on top of the vaccinations becoming more prevalent across the country and across the world is what is going to help keep everyone safe. So I just want to say thank you to everyone for listening to our presentation today. I'm sure Mike and Sri would agree that we probably could have talked for hours on this topic. So I'm hopeful that we were able to at least touch on a few things that were questionable for you or that you had concerns about. I did include our contact information here if you'd like to reach out to any of us with any further questions.
And we have some questions in the chat box. Would you be able to take a look at that and respond to some of those?
Let me see if I can. I don't know if I can see them. Can I?
You should have a chat icon at the bottom if you're using a Windows machine anyway, at the bottom of your screen, a chat box, or I can read them.
I would say, could you? I think you could. If you could read them, that would be easier.
Let me read them here. Let me see here.
I can see it too. I can answer the one from Tim. This is about he's doing some math here about how fast everybody can get vaccinated. Believe me, I have done the same math on a smaller scale with the amount of vaccine coming in and the people who have to get vaccine and the 2 doses. And you're right, I cannot explain the disconnect, but the math doesn't add up. It just doesn't. And, that's the problem with media reports and all the things you see on the news. And when you start doing all this sort of stuff, we can only deal with the real world, what we have. And I'll give you an example is that we have about 200 to 300 patients in our queue that we need to do. We won't do them till next week, late in the week, March 5th or March 6th. So depending whether they get Pfizer or Moderna, looks like Pfizer, well, we can also only vaccinate a certain amount of people in a day. One of the challenges for us, we're also running 3 long-term care pharmacies that need to serve 10,000 patients around Wisconsin and get medications to them and things like that. So we don't have a whole team of people who can just do this. So, we have to plot out who we can vaccinate, when we can vaccinate it. And to your point, we're talking about all this full vaccination by the end of July. Given the availability of vaccine, given the allocation, whatever those rules are or the challenges that exist with them, there's a lot of assumptions that this is all going to be available. We're going to be able to give the vaccine the minute it's available and everything like that. And that's just not the case. If we could do it by the end of July, that would be phenomenal. But I don't see it just because of the logistics of things and stuff like that. So I'm very hesitant to take what you hear in the media kind of as a grain of salt because the real world is not matching up to that. So
I add a quick comment to that too, that I feel like some of these reports are probably making assumptions, as Mike has said, that the increase, the vaccine doses will increase coming into the state. And if that is true and it starts increasing at a greater rate, it's been pretty stagnant in the state at 70,000 doses a week for about the last 4 weeks. So we would need some significant increases in the amount of vaccine per week allocated to the state in order for us to be able to accomplish that end of July. But if that happens, end of July could be an end goal. But that's really just a logistical thing again, and that we don't have any control over. And frankly, neither does the state. They can only request what they can request, and the federal government will decide.
Is there any conflicting? One of the participants asks that she's heard conflicting advice regarding the vaccine and taking other medications such as naproxen or tylenol. What types of advice can you give on this subject?
Yeah, I can definitely speak to this. So there's been different reports about these medications out. So in regards to naproxen, so naproxen is what we consider an NSAID medication. It's not that you can't take it while you're getting the vaccine. It's just that they're saying they've had some reports of people taking NSAID medications that have kind of dampened the immune response to the vaccine. And what we're trying to do with the vaccine is liven up that immune response to the virus. So there's nothing that says you can't get the vaccine and continue your regular routine medication such as naproxen or Tylenol. Now, if you're not on that as a routine medication, we do not recommend that you pre-medicate before getting the vaccine because that can also hide some of the side effects that we need to know about in case somebody's having a reaction to the vaccine. Perfectly acceptable to take pain medication after the vaccine, especially for sore arm or headaches. I definitely can attest to that from a personal level that I had both when I had my vaccine series. It was very minimal, very short-lived, but I did, take some Tylenol to get through that process, and it's perfectly acceptable.
Is there any place for volunteers in helping to distribute vaccines or get vaccinations done?
So Wisconsin does have a volunteer program for this whole process, and I think they have openings for multiple areas for you to volunteer, and it has nothing to do with a medical background of any means. The name of the program is escaping me at the moment. I don't know, Sri, do you know which one I'm talking about?
Is this the Weaver registry, Stacy?
Yes, the Weaver, yes, thank you.
Yeah. But the Weaver registry, I think it's more for folks who might be especially in long-term care settings when there's staff needs or there is staffing shortages. The Weaver registry helps in mobilizing folks to go into the facility. But I'm not sure for vaccination if they're using that Weaver registry or not. I'm not sure about that yet.
I had just listened to something from the state last week where I believe that they did say that they are starting to mobilize volunteers for community clinics and mobilization clinics. So and that they were directing folks to that website to volunteer. So I think they're going to expand that program across the state. So that would be good.
Could we get a
and that is there on the DHS website. It's if you look at it, it's WEAVR. That's called the Weaver registry, and then folks can sign up. I was not aware that they're expanding it for vaccination, but as Stacy mentioned, if they are expanding, that's a registry that you can enter yourself into, and then they would call up.
Excuse me, I'm not in a situation where I can write something down now. Mike, would you be able to distribute that? Because I would be interested in volunteering in this process. And I'm sure there are others who would.
Information to Mike, and then Mike can just send it out.
Yep.
Okay, great, thank you.
There's another question. When you get your shot, do they tell you when to come in for the second dose?
I think that will depend on the location that you receive your vaccine at. Typically, yes, they should at least give you the week that your second shot is due in. I think it is definitely hard to say exactly which day, 3 weeks from now, you'd be able to get your vaccine, as from a personal experience, does depend on when the vaccine is delivered to us at the pharmacy. So just because you received it on Tuesday, the first time does not mean you need to receive it on a Tuesday, 3 or 4 weeks from now in order to be compliant with the vaccine. We do have the ability to give the second dose up to 4 days ahead of time, and we can have up to 42 days in between doses and still be considered a full vaccination.
Okay, good. Do any other related COVID viruses have the same spike protein on its surface that the vaccines may also be effective against, and in an incidental manner prevent other infections besides just COVID-19?
That's a good question, but not sure about that.
Okay. Are there any meds you take? Does it matter if you take the vaccines? Are there anything other than this naproxen that we had learned about?
So from what we know at the moment, there are no medications that would stop you from getting the vaccine. In our pharmacy, we do ask questions on our survey if you're taking any blood thinners or any have any blood disorder. That does just help us when we administer the vaccine to know if somebody's on blood thinners or anything like that, that we take that extra moment to make sure we put a little extra pressure on the arm, just to make sure we're not going to have anybody that's going to bleed. But other than that, there really is nothing at this moment that we know about that would stop anybody from getting the vaccine.
Okay. Let's see here. It says, here's one. In layman's terms, do any of the 3 vaccine types contain live virus? Also, is there mercury or thimerosal in any of the vaccines? If so, which?
So none of the vaccines have live virus. So like the Moderna and the Pfizer are mRNA vaccine. They don't have live virus. And then the Johnson & Johnson is an adenovector, like virus vector, that also is not a live virus. And I'm not sure, like with mercury and thimerosal, like usually they are used in certain vaccine which have in like a multi-vial doses. But I'm not sure about this one, if they contain like mercury or thimerosal.
They do not. I know specifically, I was asked that by one of my long-term care facilities the other day, and I did the research to make sure neither Pfizer or Moderna, the 2 on the market at the moment, contain mercury or thimerosal. We typically would see that in vaccines that have, I'm losing track of my word, additives in them to continue stability. Since these vaccines are only stable for a certain period of time, at this moment they have none of those additives in there, which is actually good for us in the fact that we can then ensure that it's a pure vaccine.
Okay, no more questions in the queue here. So I just take a second to thank you, Sri, Stacy, and Mike for coming on today. This has been incredible amount of information, more than I've heard, in a year of this. I mean, it really quite an update. A reminder to everyone, I'm going to be posting this on our YouTube channel in a couple of days, as soon as I get time to edit it and put in a little bookmarks. So please check that out. Triads of Dane County YouTube. Okay.
Thank you. Thank you very much.
Any other questions at all?
Appreciate it.
Yeah. Thank you so much.
Thank you.
I
Thank
had
you.
a question. I had a question about the Johnson & Johnson. I heard that they were going to give 2 doses of that instead of 1.
For what is gone for the EUA approval process is a single dose vaccine. So I don't know about the 2 dose, but what they have asked for approval would be a single dose shot for Johnson & Johnson.
Okay.
Yeah, so
And at some time they might have a booster shot, but that's no information is there about there yet.
Okay.
I had actually read the other day that they are doing a clinical trial that they just started with a booster dose with the Johnson & Johnson vaccine to see if that does increase the efficacy overall. I'm going to guess if they don't see an increase in efficacy, then it'll stay as a 1 dose. If they do see the trial results to show an increase in efficacy with a booster, then those that receive the first dose will be recommended to receive a second booster dose. But nothing that has been shown or coming to the market on that second dose anytime soon.
Hey, Mike, can I just answer just a couple quick questions? I think someone had mentioned we didn't hit them all. As far as I know, one of the questions about if you're an educator or food pantry volunteer, what is going to be the process to prove that?
just
I haven't
about to
heard
do that,
anything,
Mike.
haven't seen anything yet on what's going to happen. You know, how they're going to prove that. I don't know whether or not they're even going to provide that sort of proof versus just kind of the honor system. And I think one of the other questions was if you want to go see when the LD patients get 2 doses, can people go see them? Well, you know, I think that might be in the long-term care setting. That's going to be up to the policy of the facility as to when they're going to start letting people return. And I think a lot of facilities, if they are letting people return, they may want to see evidence of testing and a negative test. They may run through their own protocol of, well, have you been vaccinated? And have you gone to the 2 doses? And can you show that information? So in our world, we know the facilities are itching to get daughters and sons to be able to come back and see their grandmas or moms and dads and things like this, because the social ramifications of this, as we all been talking about, have been brutal on the elderly. And but every facility is working on their own protocol and kind of depend on their own situation. So I hope that answers a couple of those questions that we had there.
And I also heard that CDC is working with CMS, like the ones that may, like, you know, regulate the long-term care settings more. They would be coming up with some kind of like visitation guidelines. For now, nothing has changed, but then the facilities, as Mike said, should work internally to allow any compassionate care, not just like end-of-life care visitation, but other visitations as well. So they do have to allow that to happen, but that depends on how the facility is doing. Like there should not be any outbreak in the facility. And then as Mike said, they might come up with their own internal policies of allowing that to happen.
Yeah, I just wanted to circle back a minute to the question about the proof of your profession for the next group of eligible populations. So the state has said that they are providing what they're calling an attestation form to anybody that is going to be vaccinating those groups of persons. So you may be required to bring in either a copy of your pay stub or a work ID to show where you work and what your profession is. And or you may be required to sign one of these forms that is basically you're signing saying that you are who you are and that you are eligible for this vaccine. So I would just be prepared for that to happen. As the pharmacies and clinics and those persons that are going to be doing the vaccinating, we have to be able to show that we are staying within those phases, or we could lose our access to the vaccine.
Good points. Okay, thank you so much. Really appreciate your expertise and your time. Thank you.
Thank you.
Thank you.
Bye-bye.